Hello, everyone. My name is Karissa, and I'm one of the nurse educators at Nursing Education and Training Australia. We call ourselves NETA. Just before we proceed on our information session about becoming a registered nurse in Australia, we would like to invite you to like and add us as a friend in our Facebook page, which is NETA OBA. We do have a Facebook page, which is Nursing Education and Training Australia, and you can follow us there too. Join us and get connected and send us a message if you've got any questions after this video presentation. So that is us in NETA. And that is our website as well, which I will be going through in a moment. But let me just quickly start our presentation because this is quite exciting. So today we'll be discussing about becoming a registered nurse in Australia, having that life as a nurse in one of the first world countries where we really want to be for work-life balance and better future for the family, and also for good career progression. So this is a photo of Cassandra. She is a Filipino registered nurse, and she is one of the clinical nurse specialists that's working in one of the busiest and biggest ICU in the Southern Hemisphere. So that is such an amazing, very good progress as a registered nurse. And if you want to be like Cassandra, the answer is here. So we at Nursing Education and Training Australia do guide students to become a registered nurse in Australia, do guide candidates. So our contact information is our website. So it's www.nursingeta.com. And if you'd like to ask us a question or you'd like to connect, definitely do the Facebook, or you can also send us an email at info@nursingeta.com. We do have our number there as well provided if you'd like to talk to us. So we are available between Mondays to Fridays, 8 a.m. to 4 p.m. Australian Eastern Standard or Daylight Time. Now, the question is, why do you want to become a registered nurse in Australia? Why Australia? So it's one of the most livable countries in the world, and there are actually a few different cities that has been showcased as the livable cities in the world as well. The healthcare system is world-class, though we know that there are also a lot of world-class hospitals where we are coming from. Australia also has the same kind of system. The nurses are very empowered. So the nurses in Australia are really an independent profession where we see in the books. So we do have our voice, we do have our input, and our care for the patients are actually very valuable. There is work-life balance, so you can see that you can feel that you're very happy at work, but also at the same time you're very happy outside of work, and you can do a lot of things outside of work. The salary as well is of course, very competitive. So you are given a salary in different years. And this one is an award of the Public Health System of Nurses and Midwives of New South Wales. So in different states, there will be different awards, and we call awards for salary in Australia. And definitely it's not much of a difference in every state. People are very friendly here. You can see that it's such a great atmosphere, great environment for families, for raising children. Your children can just go around, play in big, wide parks, whether it's a park or a water park, and also under a very good climate and, under the sun, or we do have different weather as well. Here we've got 4 actually, but yeah, it's very great for families. The community is so diverse and very vibrant, and everyone accepts everybody. And so I think it's such a beautiful place to live. When you become a permanent resident, the education is free for your children if you want to have a family, or if you are living on your own. when you become a citizen of Australia, you will have a lot of benefits as well with education. The world's best sceneries. It's one of those beautiful spots that you'd like to discover, and this is one of the. These are just few of the many. So, what's next? You need to have two things to be able to start. So, the first one is you need to have your qualification as a registered nurse, which is your bachelor's in nursing. So, some qualifications probably will be bachelor's of science in nursing or bachelor's in nursing. And also, you need to be registered as a nurse in your home country. You will then do your registration under the Nursing and Midwifery Board of Australia, which is also under the Australian Health Practitioner Regulation Agency, or what we call APRA. So you might have been familiar, you might have heard about APRA. This is comparable to your regulatory body in your home country. So I am from the Philippines, and this is comparable to PRC, or the Professional Regulation Commission, which also the Board of Nursing is under that banner of the PRC. So as a registered nurse overseas, you need to go through the Australian Health Practitioner Regulation Agency, or what we call APRA, and you will then register under Nursing and Midwifery Board of Australia. How do you do that? So the first thing that you need to do if you are a registered nurse overseas is to do your self-check. So the self-check is a process that is completely free. It just will show you your pathway of what APRA wants you to go through. So what are the steps that you will need to do to become a registered nurse in Australia? And how do you do that? So I was talking about the website a while ago. So you need to go to our website. So it's nursingeta.com. You scroll down to the bottom of the page, and you can see a pink tile there that says do your self-check in APRA, and it's free. Click on the self-check page, and it will lead you to the Nursing and Midwifery Board of Australia page. You go down to the bottom. It is very important that you read the whole information here. But if you go down to the bottom, and if you can see my cursor, there's ready to complete the self-check. Click on that and commence your self-check. The questions here are very easy to answer. It talks about privacy statement and disclaimer, and this is where also it talks about what you need to prepare after or when you're ready to submit for your registration. At this point, you don't need these requirements. So it will ask you about your profession of what you're trying to seek. So you get registered nurse, and then it will ask you about if you've held a registration in New Zealand. It will ask you about your qualifications. It will also ask you about the university where you graduated, the year that you finished it, and other qualifications related to nursing. Once you're done, you will then register. And once you register, you can then see your pathway. So when you go back to your pathway, you will see, if you're a Stream B candidate, you'll see steps 1 to 6. So when I talk about Stream B candidates, we'll go back to this stream. You need to know your stream. So there will be different categories. So there will be Stream A, Stream B, and Stream C categories. So Stream A means that you do not need to do anything to be able to register. You just have to apply for registration. And then once you've meet all the standards, then you become a registered nurse. Stream B candidate is when you will be doing your NCLEX and your OSCE, which is the 2 exams, which I will be discussing later on. And Stream C qualification means that you have to study a different qualification in Australia or overseas, where you will need to meet the standard. So in Nursing Education and Training Australia, in NETA, we do come in steps 4 and 5. So if you can see the slide, so this is the Stream B candidate pathway, and majority of nurses will be doing the Stream B pathway. So nurses from the Philippines, nurses from India, nurses from Nepal, Sri Lanka, Asian countries. There are also a few nurses in South America. You will be doing the Stream B pathway. So how would you know? You need to do your self-check. So if you're a Stream B candidate, this is where we come in to help you. So the first thing that you need to do is you need to pay your IQNM assessments fee, which is about $640. So this is payable straight or directly to APRA. I'll just go on to the next slide because it's got the fees there. So your IQNM fee of 640, and that's when you want to proceed. So the self-check is free. It will give you this pathway. What are the steps that you will take? If you're happy to proceed and if you're happy to go through the process, then you have to pay 640 Australian dollars for your step one. Once you pay your 640 Australian dollars directly to APRA, you will then go for an orientation part one. This is an e-learning about the Australian healthcare standards. Then you proceed to step 3, which is your portfolio stage. And there is no fee here, and you can do it in a day. It's uploading your documents, which will be your qualification documents and your proof of identity. And then once you're done with your portfolio, APRA will then get back to you and tell you that you are now eligible to do your MCQ or your multiple choice question examination, which at the moment is NCLEX. So the ones that nurses take to go to the US is completely the same as the one when you want to come to Australia. So it's $350 US, and you will be given 3 months period to take the exam. However, at this point, because of COVID, there has been a lot of cancellations and lesser examinees at a time. So they've given 6 months at the moment for nurses to complete the exam. Once you're done with your MCQ, you will then proceed to OSCE. So OSCE is 4,000 Australian dollars, and you will pay directly to APRA as well. Once you're done with your OSCE, so OSCE is the Objective Structured Clinical Examination, and this is like a return demonstration, demonstrating the skill expected of you as a registered nurse. Then once you're done, you will then apply for registration. At this point, that's 180 Australian dollars. So it has increased by $5. So 180 AUD. And in the website, they said that you will get your registration within the next 3 months. Majority of our students got the registration at around a month or about 4 to 6 weeks. But yeah, that's just an average time. Where do we come in? Nursing Education Training Australia will help you prepare for your test in both MCQ and OSCE. So at the moment, it says here that it's $5,500. At the moment, our package is $5,000. So at the moment because of the promo. So what I want you to do is just before you enroll, contact us because there might be some promotions going on. So at the moment, our MCQ or the NCLEX preparation is $1,000 and the OSCE is $3,000. It is usually $1,500 and $3,500 respectively. So contact us before you enroll because we might have some special offers for you, which is probably different from the current price or the standard price. So we teach question strategies in MCQ because that's one of the equally important thing for you to do when you learn the skills in test taking. And then for OSCE as well, we'll be teaching you a lot of tips, tricks, tools, the pathways, charts, and the Australian healthcare standards of practice. So how do we do it here in Australia, which is quite different from the rest of the world as well. So that's where we come in. And the preparation for MCQ is 3 months. It's designed for 3 months, but definitely you'll have access. And depending on the promo as well, at the moment we have unlimited access until your test date. But in a regular basis, it's an access for 6 months. And so as your OSCE, we deliver it within 6 months time frame as well. But at the moment, we're also saying that an access until your next test date. So that's where we come in, and we will have a different discussion about the preparation because it's quite extensive as well. So we do have different videos. So if you go to the YouTube page as well, you can see different types of videos and also different kinds of topics and discussions and nursing topics that we put in there as well. What are the documents that you require? So for your IQNM or your step 1 and step 2, you don't need any documents. For your step 3, you just need to prove to APRA that's you who's applying. So you need your proof of identity and also certified copy of your qualifications. Some officers would ask for your certificate of registration. I would say it's better for you to also attach that during your portfolio stage. They need to be certified copies. And if you'd like to ask for a copy of how to certify documents, because there are certain rules in APRA on how you certify documents, please send us a message in NETA OBA or send us an email and we will send a copy to you. Then your MCQ, you don't need any documents there as well, so as your OSCE. And then for your registration, that's when you need your English language test. So people are asking, oh, is this where do I need to have my English language before that? We do recommend our students to actually have their English language as well taken simultaneously. However, it's really up to you because you will only need your English language test on step 6, and you will also need other documents such as criminal check as well. There are students who've asked about the experience. What if I've got gaps in practice or I don't have experience at all? So fortunately, at this point that I'm making the video, so your outcome-based assessment, which is your MCQ and OSCE steps 4 and step 5 will actually equate already to your recency of practice or your 450 hours of practice. So you don't need experience if you're going through the MCQ and the OSCE. So as I said, we do NCLEX and OSCE preparation. I am very proud to say that at this time that I'm recording, Nursing Education and Training Australia has the highest number of successful candidates. And at the moment, we have made about 45 successful candidates already, which is very good. The program is really working, and we know that the way we teach actually helps nurses fight their anxiety and also put their knowledge on top of it. And they're able to perform confidently when they go to the examination. So yes, we will prepare you as much as we are able to. And we know that everybody of us as the educators, we are very capable of helping you with your preparation. We do help not just with the OSCE preparation. So as part of your registration process, you need to have the continuous professional development, which we also deliver. We also, aside from NCLEX, OSCE, and CPD, we also help you get that first job as a registered nurse. So that's very exciting. We help you with making a very good professional brand of yourself, have your CV, have your essential the essential keywords that you need to put when you do your selection criteria, and we'll do interview coaching as well. It is also very rewarding once you pass and once you become a registered nurse, because we have another side, another wing of NETA, which we call NETA Recruitment. And we do help nurses. Again, through the RN Kickstart program, we help them get their job. But also if you need sponsorship, we do facilitate, and not facilitate, but we do connect, link you to appropriate people who will be able to help you with your sponsorship, which is very good. We have helped a lot of nurses already find their first job, and we are very happy to say that they are now registered nurses practicing as a nurse in Australia. So again, if you're a registered nurse in your home country, be an Australian registered nurse. This is Charlene. She's one of our nurse educators as well. And she is an overseas nurse who's also attained her dream of becoming a registered nurse here in Australia. So she is our nurse educator. She teaches both NCLEX and OSCE. And she works in one of the very busiest hospitals in the local health district in New South Wales, in Sydney. So Charlene is an emergency nurse as well. And yeah, if you want to know more about Charlene, definitely go to our profile. You can go through nursingeta.com and then you go to our teams page and you can see your educators there and what they can offer for you. So let's connect. Thank you very much for listening to this video. If you would like to know more about nursing registration, please feel free to contact us and we will be able to answer your questions. Also, if you would like me to discuss other other topics that you would like to explore more, definitely put that in the comment section and I will try my very best to create a presentation for you to be able to answer those or to be able to discuss those for you. So thank you very much, guys. We hope to see you and we hope to help you. Bye for now.